Find out what your cells can say about your health. Cytology as a science has existed for more than 200 years, but now the time has come to summarize all data about the human cell because it's exactly the cell that can tell almost everything about the human organism. For this purpose, first of all, it is necessary to carry out a local cytological analysis that is using samples from affected body parts. Kharkiv scientists argue that such an analysis is a long outdated and inefficient method of diagnosis. The most informative method is to diagnose the condition of a body according to healthy cells. Determining body condition according to healthy cells is the most informative practice. Scientists have proven that cytomorphologobiophysical diagnostics, which is a scientific name for this test, is several times more accurate and efficient than the outdated cytological analysis. A long way to the revelation of secrets on the cell surface. Cytomorphologobiophysical diagnostics took its theoretical foundations from the works of the 19th century pathologist Rudolf Virchow. He was the first one to proclaim the postulate that any organism is a commonwealth of cells. This was the beginning of the cell theory development. Rudolf Virchow stated that each cell independently as a living organism should take care of feeding, development, reproduction, and death. In the body, a cell functions as a member of the commonwealth, is subject to the laws of this commonwealth, performing its strictly designated function within the commonwealth's organ system. Liver, kidneys, and lungs have specific cells that perform certain functions in the organism. This implies that absolutely any pathology of a cell or cell group lead to organ pathologies. This Rudolf Virchow's postulate was a rule for 150 years after the invention and practical application of the microscope, and it is used to this day. The scheme is simple. The physician sends an initially diagnosed patient to a test, and then the lab seeks confirmation of this diagnosis. The cell theory states that every law-abiding body cell must respond to morphological changes of organ functions. The peculiarity of body cells is that they respond to morphological changes by altering their shapes. For example, in case of water-salt disturbance in the direction of liquid increase, cells inflate up to shine. In case of oxygen imbalance, the cytoderm fluffs to let more oxygen in, and so on. From theory to discovery. It took Kharkiv scientists 28 years to collect the so-called album of deviations, where the relationship between cell performance and body state was recorded. At first, a famous Kharkiv geneticist Valery Gayevich-Chapazov suggested that there was a direct relationship between the bioenergy of the human body and the nature of cell nucleus motion in living cells. But no confirmation of the presence or absence of nuclei with specific charges was found, and Valery Chapazov's hypothesis remained a hypothesis. At that time, in 1983, Galina Vitalyevna Shukina was a student of Valery Chapazov's and was seriously studying his scientific works, in which the scientists and geneticists described a new concept of biophysical regulation of gene activity based on the role of the interaction of homologous chromosomes and genome. Galina Vitalyevna addressed her husband Alexander Dmitrievich Shukin, asking him for help in finding a technical way to accurately calculate the number of nuclei with negative and positive charges. Since then, Alexander Dmitrievich Shukin has been in the team of scientists. He is a nuclear physicist from the Department of Experimental Nuclear Physics of Kazan-Kharkov National University who decided to tackle this difficult task. For 8 years, the laboratory staff worked hard to find a way of accurate calculation of charged nuclei and come up with a specific number. The result of more than 1,000 experiments was a special ion trap, which affected cells with special impulses and that way made it possible to determine positively and negatively charged nuclei in cells. Thus, 8 years later, Valery Chapazov's idea was concretized. Today, by assessing the percentage of negatively charged nuclei in cells, bioelectric charge, you can easily determine the real biological age of any organism. The development of Valery Chapazov's biophysical concept became the first step towards the creation of the unique clinical diagnostic complex Luven diagnostic. Further study and research of Valery Shahbazov's concept was continued by a group of scientists led by the Shukin family. The culmination of these studies was the creation of a completely new concept in 2004, the core of which says that any changes in the organism are reflected in cells, including the cells of the buccal epithelium. It is the top layer of living cells which is very convenient for examination. The comparison of changes that take place in healthy and sick cells and study of the relationship between these changes has continued for about 30 years so far. At this point, with the help of this method, statistical data on examination of more than 20,000 patients have been collected. Since 2007 up to the present day, the works on the formalization and automation of the new method of cancer diagnostics have been carried out, together with a graduate student of the Biomedical Engineering Department of Kharkiv National University of Radio-Electronics and Computer Engineering, Shukin Nikolai Alexandrovich, Alexander Dmitrievich, and Galina Vitalyevna's son. The invention of the innovative diagnostic method has opened new possibilities for medicine, including the prevention and treatment of oncological diseases. Clinics and private offices install a diagnostic module which consists of a microscope, camera, ion trap, and computer. A laboratory assistant using a sterile spatula takes a sample of buccal epithelium cells with 3 pressing movements, from the deepest part, from the middle part of the cheek, and from the back of the lip. The epithelium taken from patients is diluted with a special solution on a glass sheet and is covered with a second glass. Only after this, the tested cells are placed under the microscope into the ion trap. Using special software, the laboratory assistant sends the data recorded from the microscope to a data server. At the server, another special program analyzes obtained images, recognizes cells in them, and determines 36 parameters for each cell. Based on the received data, a conclusion is made, which prior to going back to the laboratory assistant's computer, is viewed by the staff of Scientific Center Luven Medical. Thus, it is not necessary to train an employee in cytology for many years at the local level. And analysis results are equally accurate in any place in the world. Today, thanks to this technology, it is not only possible to help patients control the accuracy of their treatment, but also help healthy people undergo preventative examinations. The Luven diagnostic technology allows you to find out about a disease at the earliest stages of development, view the status and dynamics of the development, determine the nature and localization of the lesion, that is, the affected organ. To get more information and a complete picture of the patient's state of health, the physician would require conducting at least 19 tests in a 2-week period at a minimum. A number of studies conducted in various cancer centers showed that the accuracy of results of this technique is from 95 to 98%, which is very high in comparison with biopsy. The accuracy of computed tomographic diagnosis, for example, ranges from 50 to 68%. In addition, computed tomography often does not indicate a recurrence of existing tumor or metastases. Even if other types of diagnostic give controversial results, the use of the Luven method, due to its high accuracy, will allow you to avoid unnecessary surgical treatment. A special value of this diagnostic method is that it allows you to choose the most appropriate form of treatment, because the patient has no restrictions on the frequency of analysis and there are no contraindications. Following a course of chemotherapy, it is possible to determine the effectiveness of the treatment using this method. Luven diagnostic recognizes metastases when other diagnostic methods are powerless. For example, if an X-ray of lungs shows a blackout, specialists can only suspect presence of metastases, and in such a situation, Luven diagnostic will help to confirm or deny the suspicion. Moreover, it will allow to identify the spread of cancer cells in early stages of the disease. Luven diagnostic, as opposed to other research methods, distinguishes between chronic inflammatory and oncological processes, while other research methods, including punctures with negative results, do not guarantee the absence of malignancy. Outlook. Currently, the development of internet technologies allows the creation of diagnostic rooms based on Luven Diagnostic worldwide. In addition, Luven Medical is a research center which continues its scientific work to improve the methods of diagnosis and development of new trends in modern medicine. With each passing day, the geography of the use of this revolutionary method is extending, and it has now reached an international scale. Diagnostic rooms based on the Luven Diagnostic Complex successfully operate in Ukraine, Egypt, Russia, and Kazakhstan. Currently, equipment testing is already being conducted in order to open offices in Germany, Belarus, Turkey, Switzerland, and other countries.